Hi sir, welcome to Love Heals Cancer and ZenOnco.io. I'm Justina from ZenOnco.io. This is our cancer healing journey talk where we invite speakers who have gone through cancer, maybe as a patient, caregiver, or survivor. These cancer healing journey sessions are very close to our hearts because many patients tell us that when they listen to others' journey, it inspires them. It helps them to boost their confidence and gives them hope that if others can beat this disease very successfully, why can't they? So thank you so much, sir, for joining today's cancer healing journey talk. So could you please introduce yourself and tell us how it all began?
Sure. Thank you so much for inviting me and giving me such a nice platform. I mean, I have been following your channel through Facebook and YouTube since long, and I see you are covering a lot of good stories, good sessions, and people are actually getting a lot of help through these things. So, I mean, I am very happy to be here today, and there is one thing I would like to start with that cancer is not really good, and I mean, if detected early, cancers can be treated very well. So we will, of course, talk about this later on. So, yeah, I am Dr. Nikhil Agarwal. I am a general physician and two-time blood cancer survivor. And these days, I am much more involved in health and cancer awareness through my social media platforms. Okay, so I'll just begin my journey without wasting much time. So, yeah, I was diagnosed with AML, that is a form of leukemia, in July of 2012. So, before that, I mean, I just completed my MBBS medical graduation in January of 2010, and I was working at a hospital, and I didn't have any problem at all. In all aspects, my health was perfectly fine. My blood reports and everything was going great. It was just that I was in a habit of getting my routine investigations at least once a year. So we just had similar kind of routine checkup, and when the reports came, they were quite abnormal. And I mean, I was not experienced in dealing with cancers as such, but yeah, being a physician, I could make out there is some major issue. My WBC count was very high; it was around 60,000. Normally, it is up to 11,000. So I uh, immediately consulted my senior physician. I discussed the reports, and he was also shocked to see that because we were in regular touch. He is my senior, kind of a friend, my mentor, everything. Then he, I mean, asked me to repeat the test because, I mean, the only thing that came to mind was it may be a error of investigation. So again, in that second test, we did one more investigation along with that, and I mean, this was CBC and a peripheral smear, which are very basic tests. So in that, again, it inclined more towards blood cancer. Then he suggested me to consult a hematologist, and he gave me a very good reference. So when I went there, the hematologist saw my reports, and he was pretty much sure it is a blood cancer only. Again, the things were repeated, and it came out same. So after 2 days, he gave me an appointment for getting bone marrow biopsy, and in that it was confirmed. And in the morning, biopsy was done. By afternoon, the preliminary report was available, and the same evening I was admitted because in blood cancers, I mean, we have to start the treatment as early as possible. So the same night they started my chemotherapy, and uh, my first admission was for 30 days, and for 7 days, I had this chemotherapy, and that in blood cancer, it runs 24 hours for 7 days continuously. So, yeah, I mean, when we knew about the diagnosis, it was definitely a shocking moment, and I somehow I didn't react much. I didn't cry. I was kind of blank, and I informed my parents after getting the biopsy done, before that, just me and my physician knew about the thing. And when everybody at home came to know about the thing, everybody was the only thing in their mind was, okay, now he won't survive, because that is the concept of cancer. And everybody was crying badly, and nobody had any hope actually. But then somehow we all, I mean, discussed the things with my hematologist, and he gave a lot of support and motivation and a lot of hope. And we started on a journey. Then during initial chemotherapy, of course, there were lots of side effects and everything that almost every cancer patient and survivor goes through, vomiting, infections, pain, fever, all sorts of things. And after that, I had three more rounds of chemo. And finally, I had stem cell transplant in December of 2012. So again, the stem cell transplant is also I mean, very, I would say a toxic treatment, but it is a good treatment for the patient as such. But that phase is really horrible, I would say. And I was in isolation room for about 14 days. My parents could meet me only for 10 to 15 minutes in the evening. Throughout the day, I was alone, and lots of chemotherapy, and so many things were going on. So yeah, but the transplant was successful. Things became good. I had some post-transplant issues, but majorly things were not bad. And somehow after 10 months, I got relapse, even though things were very good. And again, nobody could expect I can get a relapse in that situation. Even my doctors were quite shocked to see that. But I mean, these things are in nobody's hand and we can't do anything as such. So again, after relapse, I had chemos, and they planned for a second transplant, but for some reasons it was not done, and I got a another procedure which is kind of a mini transplant. We call it DLI, that is donor leukocyte infusion. After that, I mean, that was in December of 2013, and since that I am in remission, and I have not had relapse since then, so things are pretty good. And I do have a lot of post treatment issues because of the DLI. There is a thing called GVHD, where it is kind of a fight between the donor cells and our own cells, and that is helpful in some aspects, but that has a lot of bad effects also. And for the treatment of that GVHD, I had to be put on immunosuppressants and steroids for almost 4 years. So because of that, I have several steroid-related complications. I initially had cataract in my both of my eyes. Then it was operated. Then I had hip AVN, it is like arthritis, and I had hip replacement surgery also. One side it is operated, one side is still pending, and I have to use a walking stick right now. So, I mean, things have been difficult, but overall, I would say if I see other cancer patients, survivors, I would say I am still pretty doing pretty good. And the thing is, of course, I have been quite strong mentally throughout the thing, but I had a great support system. My family, my parents, my sister, my uncles, cousins, everybody has been phenomenal in my journey, and financially also we are good. So that aspect was not there, which is a very common issue with cancer treatment. Then I had a great team of doctors, nurses, everybody. And being a doctor, I mean, easy access to the doctors, and things have been quite in my favor in that sense, I would say. So, yeah, that is in brief. And uh, yeah, we can go further.
So, yeah, sir, I just want to say that you were diagnosed in a very young age, and it was a very unexpected event. as you said.
Right.
So, but yeah, and your family members also thought that, because it is a stigma that if once you get
Right.
cancer, there is no surviving um, expectation. So still you overcame that twice and you are now healthy and you are doing good. So it's very good to see, and
Thank you.
being mentally strong till the entire process itself takes a lot of effort. So I give that to you, sir. It's a very
Thank
good.
you. Thank you so
Yes.
much. Yeah.
So, sir, so as you said that it was all of a sudden, but did you had any initial symptoms during the beginning of cancer?
No, I didn't have, I mean, absolutely no symptom at all. I was perfectly fine. I was doing a job at a hospital, and I mean, I was diagnosed in July, and June only I resigned from the job. I planned to study further for my post graduation, and I joined a coaching institute, and I was doing good, but it was totally symptomless. Only on the investigation it came out, and then and same thing happened with the relapse also. That time also I didn't have any symptoms, and it just came in the reports.
Okay. So, did you had any like family history of cancer?
No, no family history also, but just some. In fact, I mean, the thing is, we relate a lot of things to cancer, like bad lifestyle, addiction, smoking, all those things. But somehow I didn't have any of those factors also. My lifestyle was good. I was eating well, exercising, basic exercise regularly. I was never a gym kind of person. But yeah, and I never smoked, I never drink alcohol, but there are lots of things which are still not known about the causation of cancer. So maybe something went wrong in the genes and it happened.
I agree, sir. So, as you said, you went through so many treatments. So, could you please specify what all treatments you had, like underwent, and if there was any alternative treatment plans also?
Uh, I would say I was never inclined towards alternative medicine. It was not only because I was a doctor, even before going to the medical school, somehow I always relied on allopathy as such. Never, I mean, yeah, sometimes we do some home remedies, that is there. I still do those kinds of things and even advise to my patients, but not wholeheartedly into Ayurveda or homeopathy or any kind of alternate medicine. So my treatment was throughout with modern medicine only. So, I mean, if I brief about the treatment, again, as I said, initially it was a first round of chemotherapy, which total hospitalization was for whole 30 days. Initially, they gave chemo, and after that, they managed the effects of the chemo and lots of bone marrow biopsies. I think I would have done at least 10 to 12 bone marrow biopsies throughout those 2 years, including the first diagnosis and the relapse. And yeah, they are extremely painful, but I guess after one or two biopsies, I got used to that and it didn't affect me so much. So again, it is all about the mental process. And after the first chemo, there were three more consolidation chemos, which are not that severe as the first one. And after those chemos, I had that stem cell transplant. In stem cell transplant, just to say a little bit, what happens is they give a strong chemo and they kill all the stem cells of the patient's body. The WBC count, the WBCs are the ones which protect us from infections. So that the target is to make that count to almost zero. My count went to 200, which is like nothing. So that time we are very vulnerable to getting infections. And for that, my transplant was at CMC Vellore, though my chemotherapy was in Gurgaon itself, in my hometown. So they have very nice setup and the isolation rooms they are quite good, comfortable, and they I mean maintain very high standards for infection prevention. I had to take totally boiled food. I mean, my mother was there with me in Vellore, not in the hospital, but at a rented place. So they would cook food and then they pack in a tiffin and they come to the hospital, and there also they have to boil it again, the whole food. Even the chapatis had to be boiled. So everything was tasteless, of course, and it has to be almost no spices, those kinds of things. And then we had to eat it. So for the infection prevention, even the washrooms had water filters for bathing, for doing everything. And that was a tough phase after giving the uh, donor transplantation. I had severe mucositis, that is mouth ulcers, whole my uh, GI tract from mouth, the food pipe, everything was so badly inflamed. I couldn't even drink water. Even a sip of water would burn like I have taken a lot of chilies. It was like that. So I was put on IV nutrition that we call parenteral nutrition. Like everything was through uh, drips only. I was not eating for, I would say, 7 to 10 days, nothing at all. So that was the most difficult phase in the initial treatment, and somehow that passed and things got good. But when I had relapsed, that time again, immediately chemotherapy was started, and somehow that affected me a lot mentally, I would say, because after getting the treatment, I was feeling like I have uh, won over the cancer and now things will be good. And even my body was not that strong as it was in the initial phase because I had gone through a lot of things. My when I got relapsed, that time I was having some liver GBHD, so those values were, I mean, very bad. Things were like that. So that relapse treatment actually affected me a lot. And for a week, when I was in hospital, I couldn't sleep at all, and I used to have very bad dreams. I mean, it was so bad. I have not told about what I dreamed to anybody till now because I don't think anybody would be able to bear that. So it was like that, and things were pretty complicated that time. I became very dark. I mean, I am not very fair. These are the effects of lights, but still, I am good enough. So before cancer, also, I was fairly, my complexion was good. But that time, I became so dark. Uh, I remember once in Delhi NCR region, there are a lot of foreign patients coming from Gulf countries, Africa. So one day a guard came to my room and he saw me and he thought I am a African patient. I mean, no offense to anybody, but they have dark complexion. So he thought I am from Africa. So there was a small conversation like that. And yesterday, I mean, I was just going through my old pictures. I plan to make a post maybe today or tomorrow on my social media about the journey, like how I was before the cancer, during cancer, and after cancer. So I was just selecting some photographs, and I was I mean, yeah, I became very thin, very weak that time, and totally dark complexion, and sorry. So yeah, that was a difficult phase, but even then also, thing is, me myself as well as my family members, everybody was, of course, in a lot of trauma, but we still stood strong. We were in the mindset, okay, okay, we can't control these things. The result, the future, all that is totally out of our control. What we can do is live it to the best as much as we can. So immediately after my treatment of my relapse, I went to Vellore. The chemotherapy was in Gurgaon, so I went to Vellore for the consultation after the chemotherapy. And that time again, I planned a 2 3 days holiday to Pondicherry. So, I mean, throughout the traveling, I mean, I love traveling, and doing that has helped me a lot in staying mentally good throughout my cancer journey. Even till today, traveling is the only thing which gives me that kind of boost. So immediately after the chemo, I went to the Pondicherry. But yeah, I was not affected by the things so much. I mean, I clicked a lot of pictures. It was not like I'm looking bad, so I won't click the pictures or anything like that. I enjoyed the trip as much as I can. And later on, again, after 1 month, we went to Vellore for the actual treatment. That time the doctors told us, "Ki, we have to wait for 10 days to start the treatment." So we thought, "Ki, instead of coming back to Gurgaon from Vellore, we would just stay there itself." And there is a small hill station near to the Vellore. It's Yelagiri. I don't think people have heard about it. So uh, it was me, my father and mother. So we went there. It was not like, hey, we would just stay at room in trauma, keep crying or worrying about anything. We went there. Of course, again, back of the mind, things were there, but still we enjoyed, we traveled, and again, when I was checking the pictures. So me and my parents, we were playing table tennis there and enjoying. And anybody, if they look through those pictures, they will see everyone. I mean, each of us were actually smiling and enjoying the trip. It was not like we are having the relapse and now the transplant option is also not there. So what will happen? All that. Again, everything was in the back of our mind. Things were going on, but still we were enjoying. And after that, I had the DLI procedure. Again, it is like a transplant only, but they just give the donor cells, but they don't give that kind of harsh chemo which they actually give in the transplant. So I think in January 2014 we came back, and in March of 2014 I started having GVHD, the graft host disease, and I had severe pleural effusion, जो हम कहते हैं कि लंग्स में पानी भर जाना, that thing. So for that, I recovered in about a month, and again in June I went for a trip with my cousins. So thing was like that. Ke problems were there. They continued. They are still there today also. But I didn't stop myself from enjoying life because uh, thing is, whenever I am sick, I can't do anything as such. I just take the treatment and go through that phase. But when I recover, I again start doing things which I actually love and enjoy. Now, because of COVID, things are, of course, restricted. I have immunity issues. So, I mean, this session also we planned 2 weeks back, but then suddenly I got throat infection and we had to delay it. So things keep happening. I mean, I don't plan much because it is all unpredictable. There have been so many times once I mean, I've planned my trips or a lot of things, but suddenly I get some infection or some issue and things have to be cancelled. But that doesn't stop me to make those plans again and go with them. So yeah. So I mean there are so many things I can keep talking about. I mean it's been 10 years and things have been a lot of good things have happened, a lot of bad things have happened. So my concept is when the situation is not good, when you have some issue or anything at all, just go through that phase. The only thing we can do is, I mean, if it's a medical issue, find a good doctor, get the treatment, and let the phase pass. But once that phase passes, don't stay in that hopelessness or trauma or sadness, but just move on and try to keep doing things, whatever makes you happy, whatever you love, be it anything. I mean, for me, it is travel. For anybody, it can be different things, but everybody has things which they love to do, which they want to do. And in fact, the people who don't have cancer or anything like that, they have so many things which they want to do, but they don't prioritize that. They are like, "Yeah, okay, let us just focus on our profession and earning and all those things," and they keep postponing that. But somehow we cancer patients and survivors get a awakening about that. So we should utilize whatever the, I mean, good phase we have, and don't need not worry about. I mean, today also, see, I can get relapse any day. Nobody knows. I can get other cancers also because of the stem cell transplant. We are at relatively higher risk for few cancers, and I mean, I just completed 10 years on 17th July. I made a post about that, and a lot of people responded. One lady responded like she is 20 years past leukemia, but now she got some sarcoma. So the thing is, yes, things can happen. Anything can happen anytime. I know I am at a risk of a lot of things. I have bad lungs. In March also I had infection. I was admitted for that. Then 2 weeks back again I got infection. So yeah, I don't know what will happen. But till the time things are good, I have to keep doing things, whatever makes me happy. That is it.
Sir, you went through so much and still you're like very optimistic, still smiling so
Yeah.
bright. And you are a true example of, counting blessings and, living the moment.
Yeah.
And as you said, I truly agree with you. Traveling is one of the healing therapy, I would say. So it's really
Right.
good that you focused on living the moment and you try to prioritize your family and the supporters through who were supporting you throughout the cancer treatment. So it's really good to hear that. So
One thing, I'm sorry, I would like to say, what you said about the support system. I'm not proud of it, but yeah, I have never thanked anybody enough for whatever they have done for me. I mean, I care for all of them and they know it, but expressing that is also very important. And when I completed 10 years on 17th, I made a social media post. I thanked them personally also. Some of them I'm yet to talk to and thank them personally. And that post was mainly about the gratitude which I have about my family members, my parents, I mean, who have went through so much. Even till today, I mean, they are always in the worry that something might happen, all those kind of things. My sister, who was my donor, and she is an amazing sister. I mean, I am not even 1/100th of the good person she is, I would say, than my uncles, cousins, my friends. I mean, I have very few friends, but all of them are amazing, and they have supported me. I mean, so much. I don't think if they were in my situation, I could have done so much for them the way they have done. Then again, my doctors, my junior doctors, nurses, team, everybody. And because I had so many issues, the lungs issue, hip, and so I have been with a lot of doctors, not just the oncologist, but I mean, you talk anything, dermatologist, eye doctor, hip doctor, I mean, so many people, and everybody has been uh, a great support. And so the thing is, I mean, uh, paying gratitude to people is also very important, and it helps us to feel better actually. So yeah. So I mean, sorry, you were asking something. I interrupted. Yeah, tell
means
me.
this was actually important, being
Yeah,
thanking the ones who were always there for you is very important. And you choose this platform
right.
to just convey that it's really good.
Yeah.
So you don't have to apologize for that. So, sir, as you said, that you went through so much and traveling helped you throughout the treatment. So there would be other, helping factors that help you to cope with treatment. Like, for example, some people take it like journaling or something like that. So, what helped you to cope up with treatment during your cancer journey?
Uh, Again, one thing I'll say about traveling is before, I mean, we have been into traveling since my childhood. My parents are also travel freak, and so that has a lot of influence on me. But after the cancer journey, I have started traveling solo. So I go alone. Initially, for the first time when I went on a solo trip, everybody was too worried and they didn't want me to go. And I somehow tricked them. I told them, yeah, I'm going with you, and I canceled my father's flight. I went alone, so it was kind of like that. But yeah, after that, when they saw okay, nothing bad happened, so it has been okay. And one another thing was I have to go to Vellore for regular follow-ups. Initially, it was every 3 months, then 5 months, 6 months that way. So whenever I went to South, I planned a trip along with that, and I have traveled a lot of South India. So it is kind of like that. When it comes to other things, I was not, I'm not a good example. I didn't do much, and I actually, yeah, I had a good phase, but I had bad phases, a lot of bad phases when I felt depressed. I felt in uh, just hopeless and despair. There have been a lot of times like that. So I didn't talk to anybody about those. I mean, only the one person I told you, okay, my physician, who is my mentor and senior, I just talk to him when I feel too bad because he is a very busy doctor, so he doesn't has that much time. Okay, I can talk to him regularly, but when the things went too bad, then only I just talk to him for a little bit, and he would help me a lot. He won't counsel me for hours, but in just 5 to 10 minutes, when I talked to him, it was enough for me to go good for many months. It was like that. And apart from that, I didn't talk to anybody about my feelings, my emotions, which is not a good thing to do, definitely. And I think I suffered a bit more because of that. I diverted my time, my mind in traveling and few other things. But talking to someone is actually a great thing. And in those days, even so many groups were not there. Like today, we have a lot of support groups. You have your support group, which is nice, very nice platform. There are many other support groups. So, and in fact, I didn't even look for that, okay, if there is any support group or something. So I kept everything inside, and it hurt me a lot, I would say. Even today, I am kind of that person. I don't share my personal things with many people, but I won't recommend doing that to anybody. And I talk to a lot of cancer patients and survivors, roughly 3 to 4 people going through this every week, and I try to inspire them, counsel them, and they feel a lot better. Same thing I see when people share their things on support groups. So those things are actually very helpful, very good, and everybody should do that. Apart from that, as you talked about journaling, that is again the same thing because I am not expressive in that way. So I just keep all that locked inside, which is not a good thing again. So people should do those things, and I have seen so many people who do journaling, who talk to others, and they
Mhm.
actually benefit a lot from that. And in 2020, when the COVID started, I started sharing little bit of things on social media. I made some of my videos and some posts also, and I started my YouTube channel and Facebook page and those things. And I actually feel very good. I mean, I share limited things, but still, whatever I share, then people comment on those things, they relate to those things, and it actually feels very good. I have once in 2020 participated in one session from ZenOnco also. That was also, I mean, very good. And other thing is, I sometimes read books, sometimes watch series and movies, and I just consult few patients. I don't consult many patients like professionally, but I talk to a lot of people who are going through tough times. So these are the kind of things which help me. Another thing is like apart from traveling, going to the local places, sometimes to eat out, sometimes to just cultural shows, dance shows, music shows, then museums, monuments. I have been doing those things also because I mean we can't go on a trip every now and then. So and I mean just initially I used to feel okay, how do I go alone? Because everybody else is so much busy in their lives. I mean they have jobs, don't have that much time, they have families. So I started going alone to these things also and enjoy a lot. So yes, I mean we should not depend on anybody. If we have a partner or anybody who can accompany us, that is great. But if you don't have, don't wait for it. Just I mean do whatever you like to do. I go to restaurant, I eat alone, and I actually enjoy it. So yeah, those kinds of things.
Yeah, so as I said, it's really important to, you try to occupy yourself with the things that actually make you happy. And as you said that, spending time with yourself is also very important. And
Right.
completely agree with you about venting, your emotions out and not bottling it up. It's very important.
Right.
And it's not necessary you have to talk every time. Your type of expressing was different. Social media is your type of
Right.
expressing, so it's really good that you are slowly venting it, and there are people to support you and also
Yeah.
relate with you. So, yeah, sir, it's really good. And also, you are helping, though you are not that much expressive person, but you are still helping and reaching out to other patients who needs mental support. So it's really great to know that. So, sir, as you said that so much changes happened in this, during the cancer, throughout the cancer journey. So could you please tell me like what all lifestyle changes happened during the cancer journey and what you still follow after the cancer journey?
Okay, so again, lifestyle changes are very, very important, be it cancer or be it any disease, or even if you don't have any disease, still do have a healthy life. And to prevent a lot of diseases, including cancer, lifestyle changes are extremely important. So before cancer, as I said, my lifestyle was pretty good. I was not doing anything specific. I was not following any like particular diet pattern or any. I was not a gym kind of person, but I was active in routine. We sometimes used to go for a walk or things like that. Even my distance from my hostel to college during my graduation was pretty much, and we used to do at least 4 or 5 rounds of that. Things were like that. And before going to the hostel, I was eating out very less. It was mostly a home cooked simple foods. Even in hostel, we used to eat out because the food from mess is, of course, not so good, but still, it was not too bad. And I didn't have any habits, smoking, alcohol, or anything like that. So things were pretty good. After getting cancer, my diet was quite restricted because, I mean, throughout the treatment part, I on and off kept having mouth ulcers, so I couldn't eat much spicy, much oily, anyways. But again, I was not following any strict diet. But overall, it was good, always a home cooked food because there was also a risk of infections. So I wasn't eating out, and from exercise, walks were the routine. Even during my treatment when I was in hospital, my hematologist, he was daily, I mean, pushing me to do the work even when I was getting the chemotherapy. I mean, I told you initially it was continuous for 7 days. So throughout 24 hours, I was hooked to the drip. So the drip stand was a mobile when it had wheels. So he pushed me, "Okay, you keep walking throughout the corridor, you take the stand with you." And even at home, I followed that. I was doing walks daily whenever I was comfortable. There were some days I was not in that much strength, but yeah. So another thing that happened after my relapse, as I told you, okay, I was on steroids. So that time, there were a lot of phases. Initially, I became very weak, very thin. I mean, I told you I had lungs GVHD when there was pleural effusion. That time, my weight dropped almost 10 kgs in just a month. So I became very weak. I mean, it was like bones were showing up, as we say commonly, and then it took some time to gain back health. But yeah, same home cooked food, rich in proteins, a lot of fruits and vegetables, nuts and seeds. Those kinds of things I followed, and again, regular walks and little bit of stretching, those kinds of things. Then when they started me on steroids, I gained up too much. I mean, I'll post my photos in a few days and people can see I was actually my uh, face and everything swelled up so much. My relatives couldn't recognize me. It was so much different. And then also I kept doing the same things, uh, simple diet. Mm, avoiding the processed foods, avoiding a lot of sugars. Again, see, for sugars also, there's a lot of myth. Sugars cause cancer or they increase cancer. It is not like that. If taken in moderation, sugar is totally harmless. But if you take in excess, be it anything, I mean, even the things which are actually good for health, if you take in excess, they will harm. So it has to be a balance. So yeah, I love. I mean, I'm a foodie kind of person, so I, as I told, I went to restaurants, eating out. When I travel, then also I eat outside food, but I keep still it in control. The portion control is very important. And when you're not eating out, like even if you are eating out once a week or once in 10 days, so all other days, if you eat healthy, it won't cause you issues. So basically, home cooked food, avoiding excess of sugars, excess of fats, excess of processed foods, and these days there is another major issue is home delivery apps. So earlier people they had to put efforts of going out planning. So still that was not that frequent for most of the people. Now I know so many people who are almost daily ordering food from outside, and it actually impacts a lot on health. And then basic regular exercises. And I came back to normal physique. Again, I'm not very muscular, but decent enough. So that is the thing I have followed most of the time. And a lot of people go for many supplements and the things. So I would say the supplements are not bad if you actually need them. Throughout my cancer journey, my doctors never put me on any kind of supplements, and even I was sometimes eager. I asked them, "Do I need any supplements or the thing?" So they were always like, "No, you just take good healthy food. That is enough." But at times, I have been put on protein supplements because good protein intake is very important when we are going through all these things. Then that is it. Nowadays, I see a lot of people relying a lot on supplements. So again, it is not bad, but it has to be balanced. If somebody thinks that they don't take proper food and they can just take on supplements and things will go good. That is definitely not happening. But you take good diet, maintain good exercise, and good sleep is very, very important when we talk about lifestyle. So if you have some deficiencies, definitely you can take supplements. It is not like your supplements are banned or something. But yeah, things have to be balanced. Again, there are many cancers in which diet is severely affected, like mainly in the oral cancers, uh, mouth cancers, those kinds of things. So then people need more supplements. Yeah. And some people like to take immunity boosters, vitamin C supplements, and other things. So again, if you take in moderation, that is okay. But don't go relying excessively on those things. So it is perfectly fine. That is kind of thing. Even today, I follow, yeah,
Yes, sir.
okay. So I think that part is completed. The previous question.
Okay, sir. So, yeah, as you said, it is very important to, have a proper lifestyle, to follow a proper lifestyle plan, and the consistency is the key. So, I totally agree with you. So, sir, this cancer journey, everything was very hard. Like, so much happened, and many people were like doubtful, but you still overcame successfully and defeated this cancer. So, what would be your top three learnings from this cancer journey?
Uh, the topmost is again, cancer is not a death sentence. The main thing is about having a healthy lifestyle and avoiding any kinds of addictions, be it tobacco, chewing, smoking, or alcohol. Alcohol is definitely not good for health. Many people have a belief that red wine is good for heart and those things, but that is not true. It used to be said earlier, but the latest guidelines are any amount of alcohol is bad. But even if you have to drink, just if you drink in moderation once in a while, that is okay, but not make it a habit. That is one thing. For the treatment, very important thing is to have early diagnosis. So we have screening tests for many cancers, but there are many cancers for which we don't have screening test. So recently, I made a post about screening tests. I will be posting that in a day or two. So go for the screening test. A lot of people have a mindset that if we get a test and something comes up, what will happen? Oh, my answer to them is if something is there inside your body, that will only show up on the test. And if there is something, it needs to be treated. It can't, if you leave it there, it will keep growing on. So get the screening test. And for the things which we don't have screening test, there are symptoms. Attend the sessions. ZenOnco also has a lot of awareness sessions. There are many platforms which are having regular awareness sessions. I also conduct such sessions. So watch those sessions. Be aware. Don't neglect any symptom at all. Be it any, I would say, trivial symptom or be it any severe symptom. People have a habit of neglecting that a lot. Yesterday only I was talking to somebody who has been uh, in the suspicion of rectal cancer and they were having symptoms for the last 4 months and they were just neglecting it. So those kind of things happen. And another thing is if you are going through cancer, if you have been diagnosed or you are a survivor, everybody has a lot of issues. Don't keep those things inside. Express them, share them. There are many ways to express them. a lot of amazing groups where you have people going through the same
Yes, sir.
Okay, so you'll ask it again.
Yes, sir. So I just wanted to ask you that what would be like what all changes happen basically?
I think that got recorded. The problem started when you asked me for the 3 points. I think so.
Okay, sir. Yeah, sir. So what were your top three learnings from this cancer journey experience?
Okay. Okay, I mean, there are a lot of things which we have already talked about, but if I have to summarize, three most important thing is, uh, first thing is cancer is not a death sentence. So if you get diagnosed early and you take proper treatment, then very good treatment is possible for most of the cases. Some people may still not survive, but there is a pretty good chance. So don't lose hope whenever you get diagnosed with cancer. Some level of hopelessness and sadness and trauma is obviously expected, and that is okay. I mean, if you uh, have an issue and you want to cry or you are feeling hopeless, that is also okay. I mean, you don't have to be positive all the time, but don't stay in the negativity for too long. Just, I mean, cry, do whatever you want to do, express yourself, and then start fighting it again. And for early diagnosis, screening tests are very important. In just a day or two, I'll be posting about some cancer screening tests also. So, I mean, whoever doctor you consult, just ask them about the screening test, and I'm sure a lot of good videos are also available on ZenOnco or other platforms for that. So get regular screening tests. If you have any kind of symptom, don't ignore them. You can maybe wait for 2, 3 days, 4 days to see if they resolve on their own, or maybe some people like to try home remedies. That is all fine, but don't just keep neglecting that. And another thing is, when you have cancer, don't think about the relapse. I see this very commonly. Anybody gets diagnosed with cancer, the first worry they come is about the relapse. So my suggestion to them is you have a very huge problem right in front of you. First deal with that, find a good doctor, trust on that doctor. Don't I mean keep doubting your doctor. If for some any reason you don't find your doctor good enough, you are not comfortable, have a proper conversation with him or her. If still things are not good, find another doctor. But if you keep doubting your doctors, I mean, you will not be happy throughout the treatment, and it is not a like any fever or something. You consult once and then it is done. It is a very long journey, and you have to have a good rapport with your doctor. And don't think about relapse. Don't worry about that, because if relapse has to happen, it will happen. There is not much you can do. There are few things depending on the cancer which can be done, but just take one step at a time, one day at a time, and deal with whatever issue you have right in front of you. And I mean, maintain healthy lifestyle. Even if you don't have cancer, having a healthy lifestyle is very important. I mean, sometimes people say, "Hey, you had good lifestyle, still you got cancer. You didn't smoke, still you get got cancer." So the thing is, when I got cancer, probably because of my healthy habits, my body, my organs were, I mean, strong enough, and they could sustain through all those harsh chemos and everything much well. I mean, I had issues, but still there was not that bad. So yeah, and things help you. And again, share your story. A lot of people don't come out with their cancer journey. They have a lot of social worries, taboos. What will people think? What will people say? Don't do that. I mean, I didn't came out for a long time. From 2012 to 2020, I didn't express it. But sorry. Thing is, there are a lot of people who are going through cancer and they are looking for positive stories. So anybody, even if you are a 6 month survivor or 1 year survivor, even if you are going through the cancer, still there is a lot of hope, lot of inspiration you can give to other fighters to do that. And one very important thing is which I didn't talk about till now is the caregivers. So most of the time, what happens is that caregivers neglect themselves because they have to take care of the patient. And yes, the patient has a lot of needs, and a good caregiver is required. But to be a good caregiver, you have to take care of yourself first. If you, because it is again not a thing of a day or two, it is a long journey. If you want to be available in best of your body and mind for your patient, you have to take care of your own self. I mean, I think yesterday only I saw a post from Miss Dimple Parmar. It was about the caregivers, and that was a very good thing. During cancer journey, the caregiver they have to look for the patient, for the family, for the finances, and a lot of things. So unless you take care of your mind, your body, your health, you won't be able to do that much for the patient as much as you want to do. There are a lot of big decisions to be made, and you have to be in sound mind, in your sound health to do all that. So don't think कि अभी हम पेशेंट की केयर कर लेते हैं अपनी बाद में कर लेंगे because it is a long process and you have to be there. I mean, uh, when I was getting the treatment, my father was there with me in the hospital throughout the nights when I was admitted. And that is a bad thing, but most of the hospitals they have very good beds for the patient, but for the caregiver they have just a small stool or something which is, I mean, not that comfortable. So the caregiver has a very tough journey, and they have to be strong. Even the a lot of time people think uh, they are sad inside, but they put a happy face in front of the patient. But patient can see that. If you want your patient to feel good, you have to actually take your care. You can't just put up a happy face in front of the patient and think that patient won't know what you are going through. So you have to actually take your care. So yeah, those are the few things. And again, whatever the thing, don't lose your hope. Try to make every day as good as possible. I mean, a very famous dialogue from that Rajesh Khanna movie, जिंदगी बड़ी होनी चाहिए, लंबी नहीं. So don't count how many days you have to live because that is the something which nobody has control over. But how you live, that is largely, I mean, in your control. Again, there are a lot of days when we don't have control over that also, but there are so many days when we have control over how we live. So focus on that. Don't think about how long you have to live. Yeah, that is the main thing.
So you covered everything and you expressed everything really well. So I don't think there is anything more to add on to that. So, sir, if you want to give one message to the cancer patient or caregivers in general, what would it be?
Again, as you said, I guess most of it I covered, but if I have to say something again, so yeah, try to do whatever makes you happy. You have to, not become antisocial, but don't think about other people too much. If you do this, what will they think? What will that person think? How will people react to it? Do whatever makes you feel happy. Don't harm anybody, don't offend anybody, but you don't have to please anybody. Live for yourself. When you are happy, when you are living your life well, then only you can do anything for anybody if you want to. So, try to keep living as good as you can every day. And it is not an easy task. There will be days when you will be in bad state, be it physical health, be it mental health, and let those days pass. They will pass. They won't continue forever. But whenever things are in your control, uh, just keep trying to make it as good as possible.
Beautiful, sir. So,
And and
yes, sir.
and share your stories. Contact ZenOnco or any platform. I won't say ZenOnco is the only platform. This is a beautiful platform, definitely, but it's your choice. But do share it, definitely.
I agree, sir. So, sir, as so much happened, this would be a event or a phase of your life that you would never forget because it gave you so much. Teach it made you learn so much, explore so much about yourself, about everything that happened. So, I would just conclude this as just a chapter of your life. So, if you want to sum up this chapter in one sentence, what would it be?
Uh, it is difficult to sum up in one sentence, but I would say uh, I have been through a lot, and I am still going through a lot, but still I keep uh, trying to make it as good as possible. And uh, I would say if anybody wants to talk to me, they are always welcome. If anybody wants to talk to you people, they are welcome. And the thing which has helped me is I never worried about dying or relapse or anything like that. So just do that. Live every day as good as you can. I'm sorry I can't sum it up in one sentence, but again the same thing. जिंदगी बड़ी होनी चाहिए, लंबी नहीं. That is one sentence if I have to say.
Wonderful, sir. So, thank you so much, sir. It was really inspiring listening to
Your
you. And,
frame, again, your frame froze after I completed. So you can, repeat that.
sir, am I audible now?
Yeah.
All right. So, sir, I just want to say that thank you so much, sir. It was really inspiring listening to you and also for sharing your experiences with us. And we wish you all the very, very, very best for your future endeavors. So, thank you so much, sir.
Thank you. Thank you so much for, giving me this platform. And I thank a lot to the people who will be watching this session. And best wishes to everyone. Stay happy, stay healthy. That is, my wish for everybody. Either you are a cancer patient or a survivor, or uh, you don't have cancer still. I mean, just be happy. Thank you.
Thank you so much, sir. Bye.
Bye.